This is the 10:45 to 12 o'clock session called the Panel of QHP Executives. So as you've become kind of accustomed to with other sessions, we will have our presenters. You can enter your questions into the chat box. We'll take time throughout the session to pause, answer questions as they come in. But I'm really looking forward to this session. So as you can see on the screen, we call it the Panel of QHP Executives. So QHP, if you're not familiar with, if you're kind of new to this line of work, it stands for the Qualified Health Plan. And so what that means is that qualified health plans, they're certified by the marketplace to offer plans on the marketplace. They ensure that they have the essential health benefits. There's some other requirements under the ACA. So what we do is we bring together leaders from a variety of different health plans around Wisconsin just to share their perspectives on what did they see last year if they were in the marketplace last year, what kind of things can they anticipate for this coming year, things like that. This year, we definitely are going to talk a bit about COVID because that has definitely had an impact on health plans throughout this spring and summer. So we'll do that. The way we're going to work, we have 5 panelists today, which I think this is the largest panel for our session. And since it's virtual, we want to be mindful of background noise and not speaking over one another and how to make it flow nicely with myself included, 6 people on the line. So what we're going to do to start is we're going to have first just a little bit of a PowerPoint. And so the PowerPoint is going to give everybody a chance to introduce themselves. Then after the PowerPoint, we'll go into some Q&A. So I'll kind of basically call on people to answer as we're talking. If you have a question and you wanted it to address it specifically to one of the panelists, please let me know that. Otherwise, we'll kind of open up your questions for whoever feels like they could accurately respond to it. So what I'd like to do is to go ahead and show you who we have on today. So like I said, we have 5 different representatives from around the state. So we're going to basically go in alphabetical order by last name. Jim Baird, he's with WPS. Aaron Long, Security Health Plan. Kathy Mahaffey, Common Ground Healthcare Cooperative. Mark Rakowski, Children's Community Health Plan, which sometimes we might refer to it by the marketplace name of Together with CCHP, and Charles Rousseau with Molina Healthcare of Wisconsin. So before we dive into Jim's part, what I wanted to do is just draw your attention to where you can find the Comprehensive Health Insurance Individual Market Plans on OCI, the Office of Commissioner of Insurance's website. So as you might recall, if you were in yesterday's session with Donna Friedsam, she also shared this link. And so as Nathan had said yesterday in his session, the 2021 plans are not yet posted on OCI's site. So if you were to go to this website, you would see the select a plan year, and you can see right now your only options go up to 2020. So within a couple weeks, you would see the plan year go all the way up to 2021. Basically, once you're on this website, so that web address is right there, and I'm actually going to type this into the chat too. So I encourage you, if you have not ever been to this site, to check it out because it's just a great resource for you to kind of learn what plans are in your area. So I went ahead right now and I entered that into the chat box. So go ahead and click on and kind of just peruse and see if you're not familiar with the plans in your area. Once you're in that on that web page, you'd want to select the plan year. Of course, right now your only option would be to go to up to 2020. You can select the county, and then once you get your county, so this is just an example for Burnett County, what you would see is you'd look at the companies and you'll see who has gone through OCI and is certified to be a company in that area. But then all the way over on the right-hand side, you want to make sure that it's marketed on the FFM or marketed on the federally facilitated marketplace. So here's where you could see which ones are part of the marketplace in your area. So with that, we're going to pass it over to Jim.
Good morning, everyone. It's really a pleasure to be with you this morning, and I'm looking forward to a really good discussion with all of the panelists here. I have worked at WPS a little over 31 years now. I started in our Milwaukee office back in 1989, and as you can imagine, I've kind of seen it all in the health insurance industry through those years. And so now my current role is Executive Vice President of Health Insurance. It specifically says health insurance because we have two other very big lines of business at WPS, and they're both related to government contracts. So Jenny, if you want to switch to the next slide, I can talk about our service areas. So you see the two main service areas WPS has in the northwest part of the state, and then the eastern and a little bit of the central part of the state. The northwest, the color blue, is entirely off exchange, and that is WPS Health Insurance Company. That is the corporate parent company that offers those off exchange. On the right side, the orange colored counties are Arise Health Plan. That's a wholly owned subsidiary of WPS. Arise offers plans both on the exchange and off the exchange, and I'll talk a little bit later about some changes with Arise a little bit later. And then you'll see that a couple of counties are colored with both, and those are where both WPS and Arise are offered. I think that is all for my overview, Jenny.
Okay, thank you for that overview. So as you kind of look at this map and just kind of pay attention if, WPS is in your service area. And then next we'll have our overview from Erin.
Good morning, everyone. I'm Erin Long, and I am the product manager for our ACA products. So I manage and work on the product development for individual and family, as well as our ACA small employer product lines. As you can see, the 2021 individual and family plan service area looks a little different for 2021 than it has in past years. We will be offering two products, both on and off exchange. Our Select product, which will be available in the blue shaded counties on the map. And then we are introducing a new product for next year called Simply One. And this product will be available in the gold shaded counties for the upcoming plan year. So if any of you do have questions, I do encourage you to contact the consumer sales team. The phone number and email is on the PowerPoint slide. And I assume this presentation will be sent out after today's QHP panel, so you'll have that available should you have questions after today's meeting. So thank you. It's a pleasure to be here.
Thank you, Erin. Then we'll go to Kathy.
Well, good morning, everyone, and thanks again for having me. I always appreciate the opportunity to be on this panel and answer your questions and address things that are really important to you as you do your critical work in helping people navigate, the difficulty in attaining health insurance. So I am the CEO of Common Ground Healthcare Cooperative, and I've been fortunate to be part of the cooperative since we launched in 2014. Most of you probably know we are the largest ACA marketplace carrier in the state of Wisconsin. And that was really why we were founded, to help individuals who need health insurance who don't have employer-sponsored health care. So if you want to advance to the next slide, Jenny, I can talk about our service area. So this is a map of our service area, and we are expanding, as it notes, into two additional counties in 2021. So we operate in 22 counties, serving individuals and also small employers in that service area. We are very dedicated to helping, both consumers and navigators and enrollment assisters, as well as working with insurance agents along the way to make sure members can be served very well. And on the next slide, Jenny provides you with the information on the points of contact for our organization. I know many of you are very familiar with our team, and they continue to be here to serve you and help you and answer questions as you move along in open enrollment. So thanks again for having me, and I look forward to a very engaging session.
Thank you, Kathy. And correct, these slides are available with all of the conference materials. So if you needed to catch somebody's name or contact information, you will have access to that. All right, Mark.
Good morning, everyone. I'm Mark Rakowski. I'm the Chief Operating Officer of Children's Community Health Plan. As Jenny mentioned, our product on the marketplace is together with CCHP. Want to go ahead one slide, Jenny? So our service area is not changing for 2021. We expanded in 2020. We added 8 counties in Northeast Wisconsin, and we are continuing then with that same service area, a total of 14 counties in both Southeast Wisconsin and Northeast Wisconsin. We offer product both on and off the exchange in all 14 of those counties, and continue to offer an off-exchange only silver plan that doesn't have any of the CSR loads, so that isn't changing. We're continuing to offer that. As you look at the next slide, we have our contact information as well. So you can email us for broker support. That includes navigators. You can contact us directly through our website, or you can call us through customer service if you have any questions. We've got a team waiting to help. We're looking forward to open enrollment. We know you are, and we appreciate everything that all of the navigators are doing, especially in this post-COVID time, or the times we're living in. We think it's really critically important that people have insurance, and we look forward to your support throughout the next year.
Thank you very much. And then we'll go to Charles. So Charles, we'll see if we can hear you.
Jenny, can you hear me? I had to dial in via the phone.
Yes, you sound great.
Okay, thanks. Good morning, everyone. My name is Charles Russo. I'm Vice President of Contracting and Operations at Molina Healthcare. This is the first time that I have joined this session. I've been with Molina for a little over a year, so I really do appreciate the ability to be here and to speak with everyone on this issue and this topic. So if you can go to the next slide, please. So the history with Molina and Marketplace is that we were a very large player in the space up until, I think, 2017 when we exited. So over the last 2 years, we have really had a relaunch into the market, and we have not expanded our footprint between 1/1/20 and 1/1/21. The products are quite varied and quite diverse in this particular space. And I think we are being very prudent in our approach in terms of the product, the linkage between the product and the provider, our ability to communicate really well with members and our agents, as well as our ability to be very, very transparent during the COVID virus and what we need to do locally to support members in this very difficult time and make sure that their care is taken care of, not only from the member perspective, but from the provider perspective, and being very, very flexible and approachable in this very difficult time. So definitely feel that we are in a new norm, and our entire business needs to be very, very cognizant of that, because this is not going to go away, and we are continually being asked to be much more flexible during a very difficult time. So I do look forward to this discussion, and I appreciate being here. If you, again, the last slide, excuse me, the last slide here talks about our major contacts during open enrollment. And again, there's an informational session on the 15th, 20th, and 28th of October. And more importantly, again, is our ability to be very, very local and be very, very transparent during this virus. It's going to be here for a while, and the way we conduct our business for all our different attendees and our providers and our members are going to be very, very important moving forward. So thank you.
Thank you. Now we are going to pause for just a moment for our first poll question. So Mike, if you could load that question. And the question is to please try to name at least one insurance company that offers comprehensive health insurance plans in your county. So you could have captured that from one of the 5 panelists if they're in your county, or maybe you went to the OCI's website. If you haven't had time and you're new to this and you truly don't know, entering just "I'm not sure yet" is fine too, but you do want to enter something because this is how we're kind of recording that you were participating in this session in case you need that continuing education. So we'll wait for just one moment. Okay. All right. So thank you for participating in that. And so if you're not sure, it would be great to just kind of check that out, especially if you are on any of our listservs. We'll kind of let you know as 2021 plans get released. So for those of you who have already asked some questions in the chat, please continue to do so. We're going to kind of go through and I'll try to categorize the questions so that we kind of talk about certain topics throughout the session, but go ahead and continue to ask those. And if we don't get them to them immediately, we will get to them eventually. So the first thing we kind of want to start with for this session is just thinking about COVID. And as far as how has your health plan been impacted? So Charles, why don't we start with you? Because I know you alluded to that a little bit, but how has your health plan been impacted by COVID? Oh, and we don't hear you now. Let's see. We had you.
You got me now?
Yes.
I'm sorry. First of all, it impacted our health plan like most since March because we're not in an office anymore. So the way we interact with members and interact with providers has changed since March because we're not face-to-face anymore. Every facet of the business has been affected by COVID. And I think what we have had to do very, very quickly is really not only in the short term, but in the long term, focus in on how are we as a health plan going to support our members and providers, not only in the short term, but as you focus in on this virus. This is not going to go away for a long time. I don't think Molina of Wisconsin is going to be back in the office until Q1 or Q2 of 2021. So the way you sell, the way you interact, the way you service, how you want to make sure a member gets an annual wellness exam during a virus, because all those things are just so very, very important. So many members could not have gotten into a doctor just to go to an annual wellness exam in March, April, or May because they couldn't get into an office. And everyone here knows that that is such an important service to diagnose anything early. So that is an important aspect. We wanted to make sure we serviced many of our providers and supplied masks to FQHCs and local providers to show support, to provide lunches. So I think there is probably, Jenny, not one aspect of the business that has not been affected by COVID. But I think as leaders, we needed to take a look in the short term, what could we do for all of our customers, for our health plan employees, our members, our providers, people who are risking their lives to service our members. Then also in the long term, from a staffing perspective, from an operations perspective, what do we have to be looking at? Because anyone on this panel knows that if you're running this business 6-9 months, a year out, you have to be planning ahead. And unlike other people, this virus isn't going to magically go away come January 1st. Cases in Wisconsin are going up. So what do we have to plan for in order to make sure telemedicine is available, that we're paying our providers properly? So it's such a hard question to answer, but there is not one thing that has not affected our business because of this virus. And we all have to plan to help really the most important person, which is our member and our providers.
Yeah, thank you. And I think we all feel that way of just how much we've had to adjust and pivot and continue, to do so. Jim, would you like to add a perspective from WPS about how your health plan has been affected?
Yes, I'd love to. I agree with Charles. Ours has been impacted in a very similar way. About 93% of our employees are now working remotely. That's a pretty dramatic change compared to prior to the pandemic when it was in the low 30%. The other thing that Charles also alluded to is the shift to telemedicine, and that has been really huge. We've seen a really dramatic increase in people seeking care that way. The really interesting thing about that is that when you look at how that service is provided, whether it's from a national service like Teladoc or from a local provider, the vast majority of that increase has been with the local provider. So it's really told us that people want to continue to work with a provider that they know and trust, and not some impersonal service or someone they haven't worked with in the past. So I think those are the biggest things. One other thing that is specific to WPS is because we have business that is government related. COVID has impacted us in two ways. So on the commercial side, we've seen claims reduce, which I think all insurance carriers have had. On the government side, we are paid based on the number of claims, so that reduced, but also reduced our revenue. So it's kind of an offsetting situation that's particular to our company.
Yeah, thank you for sharing that. Kathy, would you like to add anything from the Common Ground perspective?
Certainly, I could echo the prior comments about moving staff home to ensure their safety, but to also ensure that our service levels were not interrupted at all. Numbers that was very important, and we successfully were able to do that. And then members, as Jim had said about telehealth, making sure that our members know how to access telehealth through our provider partners. But what we really found too is that our members need us more now than ever before. There is a lot of uncertainty with COVID, a lot of anxiety. And so we've done a lot of things to kind of help our members through this process. We've held member town halls where we had our members participate with our chief medical officer to get their basic questions answered about COVID, to know what the resources what resources are available to them for testing. We partnered with a local foundation to provide our neediest members with free healthy meals during this time of COVID. So, it really, as Charles said, it impacts all aspects of your business. But I think the most important thing is that, we know how important our jobs are. Right now, people need to know that they have health insurance, that if they do get sick, they have coverage. I'm really proud of our board of directors for coming out in April right away and agreeing to cover testing. Excuse me, I should say testing is required, but to cover treatment without any cost share. So we removed all the barriers that might present to our members in terms of getting the care they need. So again, I think it's time for us to step up. As a nonprofit cooperative, we're really happy to be able to do that and be there for members because they need us.
Yeah, thank you. And then, Mark, with Children's Community Health Plan, is there anything else that your health plan has seen or enacted as the result of COVID?
Yeah, there has actually. One of the things that we did immediately was we reduced the number of services that would require prior authorization. So this wasn't related specifically to COVID. This was in general. We wanted to make providers' lives easier and recognize that they were pretty stressed. So with that removal and reduction of prior authorization, we had a lot of nurses and social workers who we redeployed. And we put them on the phones making outbound phone calls. we identified what we called hotspots, Milwaukee County, Brown County early on, where we knew members were at high risk because of their demographics and the progression of COVID, and we called them. And early on, I think one of the really pleasant surprises was they just loved having someone to talk to. It wasn't even about their health, it was someone to talk to. And so our nurses and social workers made those calls. We identified those members who were at high risk, as I said, and like Common Ground, we arranged for meals to be delivered to them. We arranged for transportation of their prescriptions, so delivery of their prescriptions, so they didn't have to leave the house to get their prescriptions filled. And we've continued to do that. We've continued to outreach to those members to make sure they're not in an unstable housing situation. They may have lost their job. They may have a difficult time paying rent. So we've connected them with one of our internal housing navigators and making sure that we can help them with utilities if possible, and just making sure their lives are as stable as possible given all of the chaos around them.
You know, Jenny, if I could just add one other thing, it's really great to hear how all of us have rallied around members and providers during this time, because there's really no playbook on this, and it's really great to hear how we've all sort of had the same thing. But one of the things I found interesting was over the last couple of weeks, Molina had held provider forums, one for FQHCs and one for non-FQHCs. And the COVID virus came up. And I think the three themes that the providers all said, it wasn't even rehearsed, it just all came out the same way, was to make sure your level of communication is very clear, because these things change so quickly, and how you're communicating to members and providers is very important. The level of flexibility that I think needs to be, we all need to be cognizant of, because this virus doesn't just stop, and we have to be flexible and kind of be nimble to it. And the level of transparency that we have to have for each other needs to be very important. And the providers all echoed those thoughts to us to keep that in mind as we move forward. And I think the more we can do collectively as health plans to communicate like this, because you can have a theme and an item on September 30th, and then on October 7th, something could change, and then you have to kind of be nimble and move on the dime and keep members and providers in the loop of this stuff, because it is so fluid. So really do appreciate hearing everyone's efforts and helping everyone out. It's really great to hear.
Yeah, thank you for that. And I will just kind of say too that honestly, this is always a session we always do at the conference. And it's just great to hear, I think, especially now, of how there are common threads that so many different companies are seeing, and how just using those best practices and those strategies. I mean, I love that idea of just that really clear communication, because how is a consumer supposed to know the policy, you know, in September versus October? And so if they get used to a pattern or consistent messaging, you know, in some way, shape, or form. A lot of people have been adjusting to telehealth. That's obviously something new, and a lot of places are seeing really high show rates because it is telehealth. Other people might have different experiences. But yeah, I kind of appreciate that camaraderie, I think, at this time, especially with all the different health insurance companies. So thanks for that.
And Jenny, I think the other piece, I don't know if anyone else mentioned it, is during this time, from a behavioral health perspective, we need to be really cognizant of what our members are going through. So many have been affected in one way, shape, or form, but many people have been affected quite heavily in terms of family loss, job, having children at home. And we are seeing that from a behavioral health perspective, because that kind of support for any member, you know, really of any line of business going through this, we can't lose sight of the fact that from a behavioral health perspective, there is a great need right now because of how this has impacted people's lives. So just wanted to mention that is something I think we also need to be aware of.
Mm-hmm.
If I could add to that, that is absolutely on point. we've done a lot of reading about the impact of isolation on our members, and it is just huge. So we've tried to address that. It's a very difficult thing to address through outreach, which someone else has mentioned, and also through telemedicine, allowing the 100% coverage through telemedicine for behavioral health visits as well. And I think this is a really important topic that is somewhat overlooked right now.
Yeah, thank you. And I think that that would be a great area in staying in touch with, all of the enrollment assisters, just so that we continue to understand what is covered, what is offered from the health plans as far as behavioral health. So thank you. Erin, would you like to include some thoughts just from Security's perspective on just COVID and how your health plan has been impacted, or different things you've enacted?
Sure, thanks. So one of the things that Security Health Plan has chosen to do is premium rebates for our fully insured large and small employers. We feel that, premium dollars are ways that we help to pay for healthcare, or we help with healthcare services. And because the utilization was so low during the first few months of COVID, we chose to give 10% of premium back to our fully insured small and large employers for the month of April, and then chose to give 5% of their premiums back for the month of May. So we just recently delivered those rebate checks not too long ago. And the other item that we're choosing to do, you guys all mentioned behavioral health and telehealth services for our individual and family plan and our Medicare Advantage members. We've chosen to waive cost sharing for both primary care and specialty office visits, and this would include telehealth services. And so deductibles, coinsurance, copays, all waived for those types of services. That started August 1st, and that remains in place through the end of the year. So our members can go in and get those office visits that they need. It's a way to incentivize the care that they truly need. And we hope that they'll take full advantage of it, because it will be no out-of-pocket cost for them. We really believe that this helps to deliver our mission and vision and values. With having an integrated healthcare system with Marshall Clinic, it is a way for us to give back to our members and to our community. And if you do have Security Health Plan customers out there, please share that waiving of their cost sharing for their visits, and hope that they can utilize it to their full advantage, because this is when we need it most. We don't want them to delay care. We want them to get the care that they need, because that's what's going to keep them healthy.
Thank you. So I think what we're going to do is the second poll question. So I'll have Mike put that up. And I wanted to, I'm sorry if anybody had confusion about the first poll question. These poll questions are a little different from the other ones in that they're fill in the blank style. And so I apologize, because you probably were getting used to the multiple choice, but instead of listing all the QHPs in Wisconsin, we kind of left it as a fill in the blank. So this one is also a fill in the blank. So you'll see where it says like type your answer here. So just hearing from our different panelists, could you please just list something, anything that a health plan has seen or enacted as the result of COVID-19? So we'll give everybody a moment for that. So thank you. So again, continue to type your questions in the chat. I am seeing all of them, so we'll work to get to them. But one of the things that I just kind of wanted to, we'll probably have a couple people just respond to, thinking about 2021 now. And Kathy, maybe we'll start with you. When you think about plans for 2021, are costs expected to remain the same, go up, go down? What's kind of your stance on, or what do you feel like you could comment on in regards to that?
Oh, sure. So for 2021, I'm proud to announce that our board of directors made a decision, again, this is the third year in a row, to reduce our overall premiums for our membership. So our premiums overall are going down 6.25%. Of course, I think as everyone knows, that amount varies depending on where the consumer is located and what plan design they're enrolled in. So there's a range, of course, of premium action. But, you know, we feel very good about our continued ability. I think over the 3-year period, this represents in total almost a 35% reduction in premiums. So we want to continue to, you know, look for ways to bring costs down. That's critically important. We know that that's our obligation that we have to our members. But I also, at the same time, I recognize, I can imagine what some of the folks in the audience are thinking, that, you know, even though insurance carriers lower their premiums, that doesn't always mean that a consumer might have a reduction in their net premium. And that continues to be sometimes a challenge just in messaging. You know, consumers don't understand, you know, if health insurance companies are lowering their premiums, why aren't their premiums reducing on a net basis? And so we continue to make sure we can educate our members on that. But again, you know, I think the premium decrease is reflective of, you know, the stabilization of the ACA, the Wisconsin Reinsurance Program, of course, which has been very impactful. But we'll continue to do the work necessary to keep the premiums coming down as much as we can for our members.
Thanks. And Kathy, could you also just explain why that would be, of if Common Grounds comes down, but how the advanced premium tax credit plays in the ultimate price that the consumer will pay monthly?
Sure. So it is directly related to the APTC, or Advanced Premium Tax Credit. So members will, you know, consumers will see what they're eligible for the 2021 plan year. We always encourage members to go back out to healthcare.gov because they could certainly qualify for a higher APTC. So it's something that is important that they do. But that calculation, right, is dependent on the second lowest cost silver plan in the marketplace. And so, you know, with more carriers coming in, which is great, right, for the consumer, but that can certainly have an impact on the calculation of the APTC. So depending on how that works, again, the members' APTC could be adjusted so that their net premium, again, might go up. And we saw a lot of that in 2020, unfortunately. I think, again, last year, many carriers were able to reduce premiums in Wisconsin, but that did not have that positive impact for the member. And so it is, again, a challenge in terms of communicating and helping people understand that. And so I imagine a lot of folks in the audience will, you know, did experience that in 2020 and may. You know, we don't know actual rates yet, right? Window shopping hasn't opened yet, but you may experience that again for the 2021 plan year as you're helping people. But just know it isn't anything that the health plans have done. You know, it is a direct result of the way that the APTC, you know, is calculated.
Yep. Thank you for clarifying that. Jim, would you like to just speak a little bit about, for WPS, what your thoughts are on plans costs, or just even covered benefits as well?
One thing that is really quite a benefit is that the market for individual plans in particular has stabilized considerably over the past 2 to 3 years. When you think of the early years, 2014 through 2016, those were very difficult years for insurance carriers to even know how to set premiums. And fortunately, we're past that. We're at a period of stability. So as we look ahead to 2021, we're looking at premium decreases between 10 and 37%. And it depends, again, where in the state someone enrolls in a plan. And then at the end of this year, actually in November, we're going to give a 100% premium credit to our individual plans. So they'll see that plus the rate decrease going into 2021. In terms of benefits, we don't have any significant changes planned. The biggest change we have is that we're expanding to a lot of additional counties, so on exchange in particular. So we are on exchange in 8 counties, Region 11 this year. We're expanding to 24 counties next year. We'll still have prescription drugs, certain maintenance drugs for no copay, as well as 3 primary care visits for no copay. Those are really popular options that we'll be continuing.
Thank you. So one of the questions in the chat, so maybe we'll start with Kathy and then go to Charles, and then the other Mark and Aaron, if you want to chime in as well. But Kathy, somebody had asked if Common Ground will be keeping the same benefit levels for their plans compared to last year.
Yeah, so we have the plan designs that we've traditionally offered. And so what we do each year, right, is that the max amount of pockets and deductibles, all of those things increase. You know, we use the something called the actuarial value calculator to make sure our plans are in compliance with the benefit levels that they need to be set at. So what we do, what you've probably seen if you've worked with us year over year, is that our again, our deductibles, the max amount of pockets, they do adjust upward as we're allowed to do that. So you'll see that in our materials in terms of the increases and as I said, deductibles and max amount of pocket. The one thing I did want to mention that I didn't mention before is something I want everyone to be aware of, and that is a new benefit we're introducing in 2021 for our diabetics who utilize insulin. So on our plans, except for our bronze plans, but our silver and gold plans will all have $15 copay for tier 2 insulin. We heard from our members, you know, loudly that they needed help affording insulin. And in fact, we know anecdotally that, you know, the adherence on insulin or sharing of insulin was, you know, a real issue. So I just want all of your listeners to be aware of that new benefit. And we really believe that'll have a huge impact on people's lives.
Thank you. Charles, would you like to speak to if there will be the same benefit levels for your plan this year compared to last?
Sure. I think the approach Molina has taken, again, knowing the history, is that we had in the past had very large membership in the marketplace business, and I was not at the organization at the time, but the decision was made to exit marketplace. And in the last 2 years, we have gone from 0 members to back. We had to start all over again to go from 0 members to about 22,000 lives. And we have experienced a great deal of growth in a short period of time. So the approach in 2021 was to make sure we stabilize, keep the business solid. We did not expand counties. We wanted to make sure operationally we were doing well, and I think we have done well. We have reduced our premiums by about 3.5%. Our covered benefits are going to be enhanced a bit in terms of, again, the free teledoc services for all plans. We're broadening and expanding some of our bronze plans that we had in 2020, and we are expanding them for 21. But again, we are trying to keep the core fundamentals of our business to our members and our providers solid in terms of what is really important in the midst of this pandemic, in terms of getting prescription drugs quickly. In many cases, tier 1 drugs will be at a $0 copay, that there will be free teledoc for all of our marketplace plans, and that in many cases, urgent care copays will be the same as PCP copays if you have the ability to go into the market and obviously see a provider in person. Those are the things that are most important to us. So we want to make sure we're smart in terms of managing our relationships with members and providers, and really use 2021 to enhance our benefits to be much more member and provider focused, and to really deliver on our promises to both providers and members. That's of most importance to us.
Thank you. We had a couple questions specific to WPS, and so I'm wondering if, Jim, you would like to, let's see, maybe we could just go back to your slide even. They just want to have some more clarity on coverage areas, and so I'm going to reshare. Okay. So the question was about Marathon County, and then where are you expanding?
So Marathon County we will not be offering a plan in 21. It's likely we could expand in that direction in 2022, but that isn't in the plans for this coming year. For the expansion, it's pretty significant on exchange. So I don't, off the top of my head, recall all the counties in Region 11, but we were only in that region this year, and we're expanding to about 16 additional counties in 2021, as shown by the map there.
Thank you. And then let's see, Mark, do you want to speak at all to the covered benefits for 2021?
Be happy to. Thanks, Jenny. Similar to Common Ground, we've looked at insulin medications as well, and in fact, recognize that while preventive visits don't have co-pays or cost sharing, we want to look at other medications in a similar manner. And so we are waiving all cost sharing for 7 insulin medications. We want to make sure our diabetics don't have any reason not to get their insulin refills done in a timely manner. And so all cost sharing has been waived for those 7 insulin medications, which we think is a really positive step to keep people healthy. The other big change that we're making, like many plans, we have a closed panel of providers. We have a network, and we require our members to stay within that network. But we recognize there are situations when it is unavoidable, and individuals end up going out of network, getting hospitalized, either in inpatient admission or actually going to the emergency room. This may happen when they're out of state. It may happen on vacation. For 2020, we made a change, and we decided to cover all inpatient care that was out of network due to an emergency. So we removed what's called balance billing. We knew that members were getting bills from those out-of-state providers and out-of-area providers, and we've taken them out of the middle of that. That was the change we made in 2020. For 2021, we're going one step further. We know that again, our members end up in the emergency room, maybe not as sick as would require an inpatient hospitalization, but they might get taken by ambulance to an out-of-network, out-of-area emergency room. And so we're doing the same thing. When they are out of our service area and end up with an emergency room visit, we're making sure they don't get balance billed. We will cover the entire cost of that emergency room visit out of area as needed, and making sure that members don't then get caught up in the middle of those balance bills.
Thank you. Erin, I'd like to give you a chance to kind of just respond to just broader changes that could be coming for 2021 with security. And then I'm going to start to just kind of go through some of the things that have come in through the chat.
Sure, thank you. So actually similar to what Common Ground and others have done as far as insulin is concerned, we will also be introducing a $25 monthly cap on select insulins. And we will also be introducing 100% coverage for select diabetic supplies. So there will be a list available on our website that includes the insulins and the select diabetic testing supplies that you can receive at that enhanced benefit. We currently offer with our select plans 100% coverage for Care My Way services. So this is a service that can be connected via telephone or virtual visits. These are covered at 100% for all of our members. And we also have a $30 quarterly over-the-counter credit. And so this is a great benefit for members that generally go to Target or Walgreens or Walmart to purchase over-the-counter supplies. They get a $30 stipend every quarter place an order online through our catalog, and then the items are sent to them to their doorstep. So there's no interaction. It's a great benefit that if you do have Security Helpline customers, please encourage them to take care of or to utilize that. We do have additional value add perks that we're introducing with our new Simply One product for 2021. And so these individuals enrolled will have exclusive access to our Patient Navigator program, which is a shared service through the Marshall Clinic Health System. And it's essentially a one-stop shop to help them navigate through their healthcare, schedule appointments. Those Simply One members will also enjoy 50% off their prescriptions if they fill at a Marshall Clinic pharmacy. And they will also enjoy 30% off select eyewear if they purchase that at a Marshall Clinic location. So definitely some nice value adds for the individuals that will be enrolling in our Simply One plan above and beyond the essential health benefits that we feel are very important to our members.
Thank you. I do want to address a couple of things that came up in the chat. I think earlier today, Shannon used the term of crowdsourcing. So I always appreciate when people give us information. So one of the things we wanted to clarify for the Marathon County area is that in the past, it was Aspirus Arise or part of, so that Aspirus is no longer part of Arise and or WPS, but that there is still Aspirus Health Plan, and that is still available in Marathon County. So just to kind of look at that distinction, doesn't mean that there's no Aspirus anymore. It's just not the Aspirus Arise. And then somebody had asked, you know, is network? Oh, go ahead.
Sorry, Jenny, to clarify on that. It's not Arise in Marathon County. It is Aspirus Arise. It's a separate insurance company. So I think it's confusing because it's a similar name, and WPS used to be a part owner in Aspirus Arise. That's where that name came from. We sold off our interest in that, and it's an entirely separate insurance company called Aspirus Arise that is offering plans in Marathon County.
Okay, so Aspirus Arise, but not affiliated with WPS.
Correct.
Okay, got it. Great. And then as far as this panel, so as you know, we have 5 panelists representing federally or QHPs around the state, but somebody said, isn't network health one of them? Yes, but the thing is that when we were trying to plan for this session, we were trying to keep in mind of what we could manageably do in an hour and 15 minutes, how many panelists we could do, especially in a virtual format. So it's a combination of asks, seeing who was available, who this fit in their calendar. So this is not complete. There are more QHPs beyond the panelists today. And so that's what, if you go to that OCI map, you could see which ones are in your county. But we tried to just get a sampling from around the state and also if people were available. Okay, there are some questions about what is going to be in network. And one of the things that because we could easily get into every plan's details about in network, but what I would say is a great thing to look at is, okay, so not only are they with certain health systems, like this one is potential, you know, asking about Common Ground with Ascension, or is it just St. Joe's again? For Milwaukee County, we always make this QHP chart, and that is part of that chart. But then more generally, like somebody had asked about security, and if they network with different federally qualified health centers, that's where some of those contact pieces that people gave at the beginning with their presentations about asking those questions, if you're not sure where to find it, is a great source of information. I just don't want to take too much time because I feel like we could have every panelist go through and it could get pretty detailed pretty quickly. But one of the things that actually has come up a couple times, and this kind of circles back into the conversation that we started with COVID, was just thinking about and keeping in mind consumers who are maybe having some financial difficulty. So 2 questions that came in, I'm going to kind of lump them together, and then I'm hoping that one of the panelists feels comfortable to speak to it, is just, so for one, currently members may be terminated from their plan if they are not paid in full beyond 90 days. Are any QHPs providing additional grace period or options to retain coverage for 2020 And then another person's question was, are any premiums suspended for consumers who have experienced job loss due to COVID-19? So basically, have you changed any rules or loosened any requirements as far as premium payments given the pandemic?
So I can answer for WPS and Arise, which I was going to mention. Arise is rebranded as WPS Health Plan Inc. Just to take advantage of the strong brand WPS has in the state. We do. We don't have. We didn't suspend premiums, but we did add on a case-by-case basis. So if a customer has a concern about being able to make their payment, if we call our customer service contact center, we'll make arrangements with them to relax that grace period a little bit. But we didn't broadcast anything, to the whole world. We've had a number of individual customers and group customers take us up on that, and we have worked with them.
Hi, this is Kenny. I can respond to that as well. And, this is something that was, we identified early on that may be needed, right? That our members might be experiencing difficulties and what could we do to help? And of course, CMS put out some guidance as well. And so what we found, however, is that I think more now than ever, people knew the importance of keeping their health insurance and making sure that they were paying their premiums. And so we also, offered help to our members, but quite honestly, we didn't see too much of that being taken advantage of because I think the members do enjoy the 90-day grace period, and that is helpful, very helpful to them to help them manage the payment of their premium. So while, I think flexibility is very important, and in this time, we really saw our members paying their premiums, paying them timely, just to make sure that they had that peace of mind that they had health insurance in the event anything might happen. So.
And I think, Jenny, I'm sorry. I think this is an example of really the flexibility that you have to have, right? So when we sat out and created a health benefit for 1/1/20, we created this with absolutely no idea of a pandemic, right? It was September, October, all of 2019. So then 1/1/20 comes along, and now we're hit with this pandemic. And again, we, obviously working with providers and members and agents, extended our premium grace periods. Again, this was automatic for members. Again, we would ask, obviously, for any type of communication to our member services line, how they were instructed to handle situations like this. That is not changing in 2021 with Molina. But again, this just speaks to the example of, okay, when that happens, what do you do? We have to be very quick and nimble to make those adjustments, be prepared for the future, how that communicated to all the different customers that we deal with, because that communication, I think, is really important, because you don't want to hurt a person's ability to have insurance. So the working with members, working with agents, getting that message out in our website, these things have to be thought about, because the last thing a member with a family need to worry about is a loss of coverage. That would be just a detrimental thing right now. And I don't think any health plan wants to do that. And you want to work with a member the best way possible, because they're such unpredictable times, and it's not going to go away.
Yeah, so what I'm really hearing is that definitely to encourage consumers to be in communication with their health plans. And so if you're having financial trouble, that's the time to try to contact member services. One of the things that I appreciate Shannon Drakeber from Wisconsin Primary Healthcare Association is kind of reminding us in the chat, or reminding me in the chat, is about Cobra. And so one of the things is that there are some of those expanded timelines for Cobra. There's some, and I can share this with the whole group, just tip sheet too about kind of the flexibility with that. You know, usually if they were supposed to sign up within the 90 days or the kind of, or I'm sorry, 60 days, but a lot of that different timeline stuff. So yes, there are some flexibilities being given, and communication, I think, is where it's really important here. One of the other questions that came in, and maybe Erin, you could speak to this as well, but just about COVID in general as well, is just people are wondering about a fact sheet. Like, is there something that it helps explain to customers what's covered or what will be displayed in the summary of benefits, but really just overall that communication between the plan to the members about COVID cover benefits?
Sure. So Security Health Plan does have a COVID-specific website, and we update that on a regular basis as benefits change and we end up covering additional items. So we really encourage our members to look at that website for the most up-to-date information. Once you print information on a piece of paper, it becomes out of date. And so we want to make sure that we have the website out publicly for everybody to access. And you know, if any member has difficulty reaching that, we're happy to have them give us a call and we can send that information to them. But again, the most up-to-date COVID-related specific benefit information is out on our website. And I just do want to reiterate the fact that, you know, CMS did operationalize a couple additional SEPs for COVID-related situations. So if individuals are experiencing income changes and they're on an off-exchange plan and now they have since qualified for APTC, they can utilize that as an SEP and obtain on-exchange coverage and be eligible for an advanced premium tax credit that can help lower their premiums on a monthly basis. And I think that, in addition to the federal emergency or national emergency that was declared, individuals have an opportunity, if they have lost their job due to any COVID-related situation, go out to the marketplace and see if you qualify for coverage. And any sort of income changes, please go out there, update it, because you never know what you're eligible for until you try. And I think that's where the enrollment assisters and everyone else that's helping individuals get coverage today navigate through their options in addition to Cobra, because Cobra can be quite expensive. And if you qualify for alternative options at a cheaper monthly premium, take advantage of it.
Thank you. I'm going to try, because we have just over 10 minutes left, to kind of rapid fire through some of the questions that come in. So I will ask, and then if one person feels like they could respond, you could go ahead and unmute yourself to respond. So the first question was, if the consumer's premium is delayed, are services still processed for providers?
Can you repeat that, Jenny? I'm sorry.
So if the consumer's premium is delayed, are services still processed for providers?
Yes, for Molina.
Okay.
Yes.
And I think that,
Security.
yeah, that would be something, again, that communication is where that kind of jumps in about if a premium is going to be late. So next one, regarding COVID, in some cases, you need to schedule an appointment with a doctor first in order to get tested. Will that visit be covered as part of like the COVID visit, or would it be subject to the deductible?
This is
would be,
Mark together. Just to clarify that, so one of the things we recognized right off the bat is many people will go into their doctor and will not have COVID. And so that COVID diagnosis won't be on a claim. It will be a cold. It will be other viral illnesses. So we expanded our entire list of diagnosis codes to waive the cost sharing in this COVID time, so that very scenario, if that happens, there is no cost sharing for Together, even if they are negative for COVID.
Mm-hmm. And so that, again, would be something that the person could ask what their plan's policy is for that kind of visit, for sure. So these ones kind of are just the next two questions are really thinking about how our situations are so fluid right now for a lot of people. Employment and income is changing from month to month. So one of the questions was, okay, what if a person's income decreases due to job loss and then they became eligible for Badger Care? But now they regain employment and are able to reapply in the marketplace due to an SEP. If they take the same insurance, the same policy, et cetera, would their benefits reset with the deductible out-of-pocket amounts for the year? And so how does that come into play? Are they basically rejoining from scratch, from zero, or not, just because of people who may have bounced from one to the other throughout the same calendar year?
This is Erin. I do believe that if an individual does qualify for Medicaid and then they would go back to a marketplace plan, I think that would be a new effectuation date that would require a restart of the deductible and out-of-pocket limit. So unless you're on that plan continuously throughout the full plan year, you drop and then re-enroll, it would be a restart of that, those limits.
Yeah, I agree that that's how it would work for us. It's a great question. I appreciate the question, and I could see the case to be made to want to give credit to that individual that has that experience, but they do reset.
Yep. And then another question that came in, do you think that HSA's health savings account will be more prevalent this year to help patients with uncovered costs?
Well, I think the challenge there, HSA health savings account compatible plans, the question is, will they be more popular? Will consumers have more interest in those? Potentially, but what we find sometimes is that it becomes challenging for members to be able to fund those accounts. And so that can be challenging to say, well, I'm paying my premium, plus I need to fund a health savings account. And certainly there are consumers that take advantage of that. And I think those will always be of interest to some consumers, but that we have many members experiencing tough financial times. So I'm just not sure if we'll see necessarily increase in those for the purpose of, opening an account and funding the account.
No, I would agree with Kathy as well. I think that these times are so difficult to be able to pay a premium and then at the same time have the financial wherewithal for an HSA is such a very, it's a challenge at this point in time for so many members under the virus. So I think, Kathy, I think you're spot on. Very, very, very valid.
And I think it's really important to reiterate to individuals that, go in and get your preventive care because it does not cost you anything. Yeah. And it's a great opportunity to take a more active role in your health and then see where you're at. It's a baseline, but it's all covered free of charge. So please encourage your consumers that you're working with to take full advantage of that because it is so important.
Yeah, Jenny, I mean, I think, Erin, you're 100% right. I had mentioned that earlier when we first started. There are so many people who have benefited from a preventative exam and were able to find out very early about some very serious illnesses. And in 2020, because there was such an inability to get that preventative, there was such time in 2020 where people couldn't go. And my worry for anybody was you weren't able to go to the doctor. I think we all could probably share this experience where you go for an annual. Well, you couldn't go for an annual. You couldn't get in. And then when you could get in, the line to get in was very, very long because appointment slots weren't as large as they used to. So I couldn't agree with you more. The need to make sure and get that baseline. And if you had them for a number of years and you have this block of time that's empty, there are ways in this virus for people to get preventative exams done, get your baseline blood work done. It is not going to cost the member a dime. And that's the worry I have, for family members, myself, or anybody. It's so important to have that because you could curtail a serious illness so early, and we just haven't been able to do it the way we used to. I think that's really a serious, I hope that people who are listening are urging that, because even in a virus like COVID, it can be done.
Thank you. One of the things, because a couple questions came up regarding silver loading, so I'm hoping somebody can feel comfortable to just explain what silver loading is, why does it happen, and have you heard anything from HHS about prohibiting the practice of silver loading in future plan years?
I can take that one, and I'll try to be as non-technical as possible. But I think many of you know that there are certain consumers, those that are between 100 and 250% of the federal poverty level, that qualify for benefit plan designs that have a lower out-of-pocket. So the deductibles are lower or non-existent, the co-pays are lower. So it's really to help those consumers, to be able to not only get the premium credit, the advanced premium tax credit, but also when they go to the doctor and they use services, that cost won't be a barrier. And so the cost share reduction plans are a requirement of the Affordable Care Act, and all of us that are on the marketplace must offer these plan designs. It's a requirement. And there are variations of them depending on where the member falls in the federal poverty level. So again, a real positive. I think this is a real great part of the Affordable Care Act. But one of the other provisions is that health insurance companies would receive money from the federal government to help offset the costs. Because as you might imagine, a premium for a plan that has a $50 deductible is a lot higher than a premium for a plan that has a $5,000 deductible. So the way that the Affordable Care Act was structured is that health insurance companies would receive money every month to offset those better benefits. And unfortunately, there was, a lawsuit around the cost share reduction payments. And then in October of 2017, the administration abruptly ended those payments. So 2017 was very challenging because we had no ability to make up that money, right? And so fortunately, our state regulator said, hey, we want health plans to be able to continue to offer coverage, but we know we have to help them because they're required by law to offer these plans, but the money from the federal government has stopped. So one of the things that our state regulator and many states did is to say, okay, the way we can get through this and make sure carriers don't completely exit the marketplace is to allow you to increase your premiums to account for the loss of these dollars. And so that's what silver loading is. Health insurance companies are allowed to increase premiums on their silver plans, and so that we can continue to be here and serving members. So it's a concept called silver loading, and it's critical because without it, I don't know any of us that could offer health insurance on the marketplace. So we know that this practice is allowed to continue by HHS, and we're obviously too we there was another lawsuit filed contesting this whole removal of the payments, which we did win that lawsuit, but we don't know what the future holds in terms of the practice out a couple years. But again, one two things have to happen. We have to either be able to silver load, or those payments from the government need to restart.
Thank you for that explanation. I'm glad this is recorded because I think that that's something that as we hear about that, I think you provided a really nice, simple, concise explanation. So I appreciate that. I do want to be mindful of our time. I just want people to know because this session, we had so many things coming in through the chat. So I appreciate that. I want you to know that we will share all of these comments and questions with our panelists so that they just kind of have a sense of what kind of questions do our enrollment assisters have. I definitely saw a handful of questions about just other covered benefits, behavioral health, mental health, that coming up for sure. Just people's opinions on the future of health insurance and all those kinds of things, short-term policies. There's a lot of really good questions come up. So we will make sure to share with our panelists so that they can kind of keep a pulse on what's at the forefront of the enrollment assisters' minds. So that'll all be shared. If you did enter a question and you did not feel like it was sufficiently answered, feel free to reach out to me. Hopefully not crazy bombardment of questions, but I do want to kind of be mindful of our time today and wrap up, but also want to provide you with some answers if you feel like there was something that you didn't quite get answered during this session. So on behalf of Covering Wisconsin, I just really want to thank our panelists today. We appreciate your time and just your willingness to share your perspective on behalf of your plan.